It is the responsibility of the government to protect the country and save as many lives as possible in a crisis, disaster, or outbreak. And they need to take responsibility for expanding on their measures when deemed necessary. Now, I, along with many others, have been affected by the events of COVID-19. And with both my parents being doctors, I want to help by proposing a solution. The United States Health and Human Services needs to acquire and maintain a sufficient quantity of stockpiles of equipment in order to treat patients during a pandemic. To address this issue, I'm going to talk about the problem of being unprepared for a pandemic, then how acquiring hospitals and medical centers with reserves, which will help save more lives, which is a cost that many are willing to pay. With the lack of supplies of medical equipment, patients are not being safely treated for their illnesses, and employees as well. This, of course, leads to more and more lives being lost, and of course, this also leads to medical centers and hospitals being short of thousands upon medical equipment. From Dennis Wagner's 2020 Columbus Dispatch article, Overwhelmed with Hospitals, Equipment Shortages, Coronavirus Pandemic is Playing Out as State Planners Expected, the United States government's strategic national stockpile is 90% depleted, causing hospitals and states to go into bidding wars for resources. So with stockpiles so low, medical staff are being forced to make life or death decisions due to the shortages. This, of course, is something that no one should even consider in the case of a pandemic, because too many lives will be lost. From Meg Whittaker's 2020 Denver Post article, Short on Ventilators, Colorado Hospitals Prepare for a Worst-Case Scenario for Coronavirus Patients, in the worst-case scenario, Colorado could be short as many as 10,000 ventilators for coronavirus patients. But hospitals and government agencies are trying to avert a situation in which doctors have to make life-or-death decisions about who gets desperately needed care. So now that I explained the problem of the country being short of equipment in a case of a pandemic, I want to talk about now how the HHS needs to acquire the stockpiles in order to save more lives. So, of course, I'll explain how that will work. So, the HHS will acquire reserves of medical centers and hospitals of stockpiles of equipment based off the population of the city or town. Most of the stockpiles right now are for entire states, which of course is the big situation, but having them for cities and towns will be more sufficient. From David Buffenthal's and Elizabeth Fowler's 2020 Harvard Business article, It's Not Too Early to Prepare for the Next Pandemic, building into this National Healthcare Reserve, a government structure that will keep the contents tested and up to date will be essential. Congress also needs to build an information system that will enable the country to deploy these surge resources to where they're needed. Among other things, this means modernizing the U.S. public health information infrastructure so it's capable of tracking in real time the availability of critical resources like hospital and intensive care unit beds, devices, drugs, and personnel. So, of course, the big question of this was, how is the government funding going to look? Well, the $2 trillion bill that the government provided earlier in April is a good analysis on how much money will actually go into this. From Kelsey Snell's 2020 National Public Radio article, What's Inside the Senate's $2 trillion coronavirus aid package, there is $100 billion for hospital responding to the coronavirus. The bill provides $1.32 billion in immediate additional funding for community centers that provide healthcare services for roughly 28 million people. Center for Disease Control programs and response efforts are getting $4.3 billion, and the bill gives $16 billion to the Strategic National Stockpile to increase availability of equipment, including ventilators and masks. So, with these stockpiles in place provided by the HHS, when the next pandemic hits, more and more hospitals and medical centers will be more prepared for a pandemic, which of course leads to saving more lives, which of course is the cure. So with stockpiles being used to help save more lives more efficiently, this means hospitals and medical centers can actually truly rely on these stockpiles in medical, because unlike what's happening right now. From Ben Gittleson's 2020 ABC News article, after Kushner says it's our stockpile, HHS website changed his comments on a federal crisis rule. Retroactively matching what Kushner said, the website no longer says states can rely on the stockpile, but now it says it exists to supplement them. The Strategic National Stockpile's role is to supplement state and local supplies during public health emergencies, the website read on Friday afternoon. Many states have products stockpiled as well. The supplies, medicines, and devices for life-saving care contained in stockpile can be used as a short-term stopgap buffer when the immediate supply of adequate amounts of these materials may not be immediately available. So, Unlike the current events, if the HHS had these stockpiles in place, not only could the hospitals and medical centers use them to save more lives, but they could actually truly rely on them. From Emily Zacker's 2020 Newsweek article, more than 10,000 people have now died of coronavirus in the United States, the nation's updated fatality count, which climbed to 10,335 on April, now represents roughly 14% of the global total. Coronavirus task force members Dr. Deborah Birx and Dr. Anthony Fauci projected that COVID-19 could take between 100,000 to 240,000 U.S. lives overall. Even with containment measures in place, New York has experienced the highest density of COVID-19 cases in the United States, having reported more than 130,000 positive diagnostics and at least 4,700 deaths. So, with these stockpiles in place and helping the hospitals and medical centers treat their patients, this saving more lives, I think many would agree that it is a cost that many people are willing to pay. So, the cost to enforce this will not be cheap, as mentioned before with the $2 trillion bill analysis. But, however, just because that the bill itself was large doesn't mean that actually funding these stockpiles will not, as proven with this. From 2020 Public Health Emergency article about the National Stockpile, the Management and Business Operations branch provides operational support. This branch manages quality control of the stockpiles inventory and IT support of inventory management systems and manages fiduciary responsibilities associated with the budget that often exceeds $500 billion. So, of course, the cost of a human life is crucial, along with no certainty of the next pandemic. But based off of this, it's possible to actually fund these stockpiles. But of course, we have to fund these stockpiles, or else events like this pandemic could possibly be mirrored, or even a pandemic like the Spanish flu. From Mark Honingbob's 2018 Guardian article, Spanish Flu, the Killer That Still Stalks Us, 100 Years On, the global death toll was inconceivable. According to the most recent estimates, between 50 million and 100 million people worldwide perished in three pandemic waves between the spring of 1918 and the winter of 1919. Adjusting for the population growth, this is equivalent to 200 million and 525 million today. So, with these pandemics that have been affecting the country, the cost of saving lives is surely worth it. So, having the HHS acquire these stockpiles is, of course, a crucial thing to do in order to save as many lives during a pandemic. So the plan to having them do this is possible, but of course, we need to take action in order for this to happen. With the current events showing the lack of preparation, requiring hospitals and medical centers to have reserves will help save more lives, which is something many would consider the cost they're willing to pay. The United States and Human Services needs to acquire and maintain a more sufficient quantity of stockpiles of equipment in order to treat patients during a pandemic. Now that you're aware of this, it's time to raise awareness and help spread the word on this solution. It is the responsibility of the government to protect the country and save as many lives as possible in a crisis, disaster, or an outbreak. But it's our responsibility to speak out and let the government hear our voices.